At this point, we're all taking our directives and our lead from Interior Health, and there's been a number of meetings that have been had between all the service providers. So everybody's working with this to the best within what's capable for them.
Are you worried yourself about this?
I'm worried and I'm not worried. I think we all have due diligence. You know, the no handshaking, of course, that's going to change things a little bit because we're all about giving people, you know, a hug and those kind of things. And I think it's going to be difficult. The more people are sick, it could be something as simple as the everyday flu. And yet we're going to be exclusionary because we don't know if it is just a flu bug. So.
Have you seen any cases now of the flu?
Well, I've seen a lot of sick people, and I think my biggest concern about this is that the population that we work with, their health is already so compromised that we stand to have a lot of people very, very sick and possibly a lot more death within our population group. I really dislike the concept of vaccine first, who gets it first. That's exclusionary. I think that anybody that has a health risk should be given the vaccine if that is what they choose. I don't know enough about the vaccine at this point to state that I think that it's the best thing for people to do. So we're going to, when people are asking us questions, we're going to refer them to Outreach Urban Health next door, to their doctors if they are fortunate enough to have one. People that are showing all the signs and symptoms that we've been made aware of, we'll work with them to the best of our ability.
Protocols that are in place for us. One has to do with the staff and one has to do with the clients. The staff one we worked on in conjunction with BC Housing. It's something that we have to have in place, and that's what will happen if and when there's an outbreak of N1H1. It has to do with our staffing. It has to do a lot with also the practical basic things of cleanliness, covering a cough, washing your hands, all of those things. The second protocol that we have is one that we've received or had help with Outreach Urban Health. That has to do with what happens or how we treat the client if we have one of our clients that presents with N1H1. And that has to do, again, of course, with practical things like cleanliness, but also isolation and distance and that sort of thing. The other thing we're doing, of course, we're in contact with other social agencies so that if there is ever a problem, if there's a real outbreak, then what we'll do is we'll work together, social agencies, to take care of that. The good news is that I heard today we're going to be starting vaccinations next week, it looks like. So we're hoping that, of course, is going to help get on top of it before anything serious happens. From what I understand, they're going to try to cover the entire population, homeless population here in Kelowna. My understanding is that they have enough vaccines for that. The vaccinations will take place either at Urban Outreach Health. We'll also set up a clinic in our hostel itself to serve our clients and our staff and partner with Outreach Urban Health that way to get the vaccinations out.
Are you worried about it?
You know, it's, I don't know if worried. I don't think I'm worried. I think we're taking the right precautions. It's not something that we should be fearful of, but we don't want to ignore either. So we're doing the best we can. And my understanding, it's a strain of the flu. It can be more serious than some of the other strains, but a lot of it is common sense. And the other thing is, for any staff, if they're sick, they stay home. We don't allow them to come to work.
Have you seen any cases yet at all here?
We have. We haven't done the swabbing, but we've had people who meet the conditions of fever and productive cough.
Are they classified, the homeless population, as one of the high risk, do you think?
I would say so, mainly due to the chronic health issues that are definitely overrepresented in this population.
Great. Have you seen anything like this before?
Not in my experience in the last few years, but again, it is very similar to what we get with the seasonal flu that happens every year.
Why do you have a mask on?
I have a feeling I got the H1N1 virus or whatever.
How do you know?
I've just been sick, and my roommate downstairs told me that he's been diagnosed with it. So.
And what kind of symptoms do you have?
Fever, hot and cold, cough until I can't cough anymore, short of breath. Yeah, so I got a weak immune system as it is anyways. Yeah, I'm HIV positive, so.
Oh, I see. So that's probably quite dangerous for you being HIV positive.
Oh yeah, I get pneumonia and whatnot all the time, chronic bronchitis and whatnot. So.
And so will you be taking the vaccine when it comes in?
Oh yeah. Yeah, I take all vaccines for everything. So.